It's still February 28th, and we have Legislative Council with us now. So Legislative Council would like to come up. I just want to, in full disclosure, I just want to say that there was some language that was brought to us very recently. And honestly, our Ledge Council has been working day and night and to find times where we can get her in here, and we were able to snag her for 30 minutes today. So thank you so much, Jen, for coming in. And she's going to walk us through some of this language. We'll hear from the board, and it's my intent that we're not really going to do anything with this today. It's just something I wanted to put on the table, and then after town meeting break, possibly take it up. So, right.
All right. Good morning. Jen Carvey from the Office of Legislative Counsel. I will put some language up. And do you want Kristen to post?
Oh, yes. If
language, okay.
You could post the language.
She told her to follow the share. All right. Great. So this is drafted as a committee bill, and it be called an act relating to authorizing the Green Mountain Care Board to appoint a hospital monitor. It amends, in section 1, it amends 18 VSA section 9456, which is part of the Green Mountain Care Board hospital budget review statute. And it amends subdivision G first by just splitting it into a making the existing language subdivision 1, and then making a new subdivision 2 that would say that the board may, at its discretion, appoint an independent monitor with respect to any matter related to the board's review or enforcement under this section if the board believes that doing so is in the public interest. At the direction of the board, the independent monitor may oversee the hospital's operations, obtain information from the hospital, and report findings and recommendations to the board. I would say that an independent monitor appointed pursuant to the subdivision 2 shall have the right to receive copies of all materials related to the board's review under this section, and the hospital shall provide any information requested by the independent monitor, including any information regarding the hospital's participation in a hospital network. The independent monitor may share information provided by the hospital with the board and with the Office of the Healthcare Advocate in accordance with subdivision D3, which talks about them keeping information confidential, but shall not otherwise disclose any confidential or proprietary information that the independent monitor obtained from the hospital. And the board may order a hospital to pay for all or a portion of the costs of an independent monitor appointed for the hospital pursuant to this subdivision 2. And then it would take effect on passage.
What precipitated this?
Can't answer that question. I can tell you what the words on the page do. So
Do we know what?
Well, we'll be hearing from the board. Any questions on the language, Mel? So this, just to be clear, Jen, if I'm looking at this language, it doesn't change anything around current review or enforcement. It just allows the board to appoint an independent monitor.
right. I mean, it doesn't alter the review process or the enforcement or budget, how budget orders are enforced.
Yeah.
It allows an independent monitor.
Right. Any other? Okay, thank you. Diane, you want to come on up? I've got on this power management sharing committee. Not that long, right? Oh,
That's not gonna work.
no. Oops.
This
It says HP. Did you hate that?
Can you lower?
Special.
Thank you. I don't know, this is state computer.
And welcome. I think this is the first time we've had you in the chair, isn't it?
This is true. Thank you, Madam Chair. And committee. I appreciate this opportunity, to speak to the comments. This was a developing thought yesterday afternoon. As you know, that I would have been home today and tuning in via Zoom, but I thought this was important enough and to come and make myself available to the committee to speak to at least where it is at the moment. So for the record, I'm Diane Lanfer. I'm the Director of the Legislative Affairs at the Green Mountain Care Board. And I thank you and the committee for taking a moment to hear from the Green Mountain Care Board on this particular topic. You are working really hard to hear from many entities who are deeply involved in the healthcare system. And this is not an easy task at a particular time and place of where we're at currently in the big picture. This is a challenging time, especially when healthcare affordability is in crisis and there is an insurer with insolvency issues and risks. The hospitals continue to have significant financial overages. And the Green Mountain Care Board has also recently seen a notable uptick in hospitals out of compliance with Green Mountain Care Board's orders. At the same time, hospitals are also continuing to experience overall financial difficulties in some extreme. This language is the start of the conversation that would provide a resource to assist a hospital with monitoring for compliance with budget orders and to help prevent budget enforcement issues from materializing in the future. Green Mountain Care Board needs the authority in this language for a monitor. This language would also allow, in limited circumstances, an independent monitor to review and assure budget submissions are accurate, reliable, and won't lead to budget overages. We would like the committee to have this language to assist the committee when a Senate bill comes over soon. Thank you for allowing this topic to be heard before you leave for town meeting. I know that your minds and thoughts are full of a lot of things. So this conversation can continue in conjunction with the large Senate bill discussion you will have upon your return, or it could stand as an all-alone bill. So I appreciate your time, and Green Mountain Care Board wishes you well wishes on your town meeting break.
Any questions for Diane? Woody?
What is considered in the public interest? Says,
Yeah.
Green Mountain Care Board can appoint an independent monitor to oversee a hospital if it believes it's in the public interest. So what's the definition of public?
Well, I think we can work on that together, but I think right now the public interest is what pretty much the Green Mountain Care Board is always functioning in lieu of as a regulator on behalf of the state in the public's interest. And we have a great deal of transparency. I've learned a great deal about the effort that the Green Mountain Care Board takes very seriously their task when in law. And I would dare to try to define that right now, but I think we can continue to have that conversation. There's probably other places within our rules that we can define that.
And when our public health emergency or our issues are no longer in existence, will this go away? Will this bill sunset? Is there a timeline with it?
I don't believe so. Right now, there is a crisis, and it's one of the things that would be driving the need for this monitor at the moment when we have so many, or not maybe several, but one that are out of compliance, and that there's budget orders and there's a struggle there. And that's not to say that other hospitals that may not even have a budget order, but may be struggling with being able to stay within their budget, may need help. So this monitor could continue in that capacity. We could see that.
And I'll just say, as if we decide that possibly this is something we would like to include in the Senate bill in the future, if it's something we decided we want to do as a committee bill, we will be walking through and, you know, talking about all these things. This is just the language that's been presented with us. It's our job and our role to sort of tweak it and get all those questions answered with the language.
Just one more question, sorry.
Of course.
Doesn't the Green Mountain Care Board already have some of these powers right now?
We do not have the authority, which is why we come before you to ask for that authority for a monitor.
Any other
I
questions?
guess I got one. It's what we're talking about, an independent monitor. Is that somebody they're going to assign to this case? Or is it somebody from the Green Mountain Care Board?
I think I wouldn't dare to speculate, but I would say that right now, everyone at the Green Mountain Care Board is extraordinarily busy with the tasks that they have and in helping the state and the agencies deal with the crisis, as long as in partnership with the governor. There is a lot of work underway, but it would be nice to have, when there's discussions that may be difficult, when you have an independent monitor to be able to facilitate that conversation.
Right. Thank you, and thanks for sticking around for us.
You're welcome. I'm at your service.
All right, so we are done with committee until, and I'll have to excuse me, because I know it was in flight. Kristen, is it 2 we're back or 1 o'clock? Okay, we were having some legislative council. I was trying to get legislative council to come in earlier than scheduled. So we're back at 1 o'clock, which means we might get out of here earlier than I thought we were going to be able to.